Haemophilus is a small gram-negative biliomorphic bacteria. This means, and the tear or gram stain can be shown small, middle, and large bacilli. Required to enrich media, usually containing blood or its derivatives, for enhancement the growth of this bacteria. Haemophilus influenza type B is the most important pathogen in this genus, and secondly, or followed by Haemophilus ducrei. A sexually transmitted pathogen causes chancro. Other Haemophilus species are among the normal flora of mucous membrane and only occasionally causes a disease as an opportunistic pathogen. Haemophilus influenza is found on the mucous membrane of the upper respiratory tract in the human. It's an important cause of meningitis in children and occasionally causes respiratory tract infection in children and adults. This bacteria, along with the Streptococcus pneumoniae, is the major cause of meningitis in children. Now, culture of this bacteria, this is very important. This bacteria is cultured on chocolate agar to produce flat, grayish brown colonies and a diameter of 1 to 2 millimeters. Are present after 24 hours of incubation. Haemophilus influenza does not own sheep agar except around colonies of staphylococci and produce phenomena that called satellite phenomena. This occurs because of identification of this organism of Haemophilus group depend in part on this of two important factors. The first factor is X and V. Factor X physiologically as a heme, and factor V can be replaced by nicotinamide adenine dinucleotide or NAD or other coenzyme. This two-factor, heme and NAD, should be present in the media that used for cultivation of Haemophilus influenza type B. Because of staphylococci able to hemolyze blood on blood agar, which lead to liberation of heme from the RBCs, and its ability to produce or release extracellular NAD in the environment, this leads to development of satellite growth phenomena. يعني شباب احنا بالنسبه لنا اما انه نقوم باضافه الاكس او الفي فاكتور الى الوسط الزرعي الى البلاد اجار، او انه يتم زراعه البكتيريا مع بكتيريا ستافيلوكوكاي. يعني ستافيلوكوكاي مثل ما معروف ستاف اوريوس is a beta hemolytic able to destruct RBCs and produce heme, also able to produce extracellular NAD to the environment. These two satellite phenomena. The growth around the staphylococci colony is heavy, then decreases gradually according to the concentration of NAD. Antigenic structure of this bacteria encapsulated. Bacteria contain capsular polysaccharide of one of 6 types, A2. A capsule of this bacteria represents a main virulence factor. Non-capsulated Haemophilus influenza is avirulent. A capsule swelling test or calling test with a specific antisera is analogous to the cooling test for pneumococci. Somatic antigen of Haemophilus influenza consists of outer membrane protein liposaccharide as endotoxin. Oligosaccharide, not lipopolysaccharide, because of the chain of sugar is short or shorter than the source of lipopolysaccharide, but remain act as an endotoxin for this bacteria. Also share many structures with those of Neisseria gonorrhea. Now, pathogenesis, Haemophilus influenza produce no toxin, unable to produce toxin, but the capsule is antiphagocytic. In the absence of specific anticapsular antibodies, the polyribose phosphate capsule of type B Haemophilus influenza is the major virulent factor of this bacteria, as this capsule can be enhancement a humoral immune response to produce antibody against this bacteria. Type B Haemophilus influenza causes meningitis, pneumonia, and empyema, epiglottitis, cellulitis, septic arthritis, and occasionally other forms of invasive infection. Non-typeable Haemophilus influenza tend to cause chronic bronchitis, otitis media, sinusitis, and conjunctivitis, following the breakdown of normal host defense mechanism. The blood of many persons over age 3 to 5 years is bactericidal for Haemophilus influenza because of containing a large amount of antibody against bacteria. And the clinical infections are less frequent in such individuals. Infection with Haemophilus influenza type B increase in the age group between 1 to 5 years and decrease with age. Clinical finding, Haemophilus influenza type B enters through the respiratory tract. There may be local extension with involvement of the sinuses or the middle ear. Haemophilus influenza type B and pneumococci are two of the most common etiologic agents of bacterial otitis media and acute sinusitis. طبعا ما ننسى انه هي main cause of meningitis. Organism may reach bloodstream and carry to the meninge, or less frequently may establish themselves in the joint to produce septic arthritis. Prior to the use of conjugate vaccine, Haemophilus influenza was the most common cause of bacterial meningitis in children aged 5 months to 5 years. But this percent or this cases decrease dramatically after use of vaccine. Now, we used vaccine against Streptococcus pneumoniae and against Haemophilus influenza type B. Fulminant obstructive laryngotracheitis with swollen, cherry red epiglottitis developed in infant and require for prompt tracheostomy or intubation as a life-saving procedure. Pneumonitis and epiglottitis due to this bacteria may follow upper respiratory tract infections. In small children and old or debilitated patient, immunocompromised patient, adult may have bronchitis or pneumonia due to Haemophilus influenza. But this cases is a decrease gradually due to using of vaccine. Diagnostic laboratory test for this bacteria, including specimen, consists of nasopharyngeal swab, pus, blood, and spinal fluid for smear and culture. Nasopharyngeal swab. A nasopharyngeal swab is the specimen of choice for detection of carrier stains, and also used for detection of upper respiratory tract infection and others. Data identification by using kits are available for immunologic detection of this bacteria in spinal fluid. A positive test indicates that the fluid contains high concentration of specific polysaccharide from Haemophilus influenza type B. This when the spinal fluid is taken to lab as a turbid. We done several tests, including smear, culture, immunologic detection or antigen detection directly from CSF, also detection of total protein and glucose and white blood cells. In case of meningitis with Haemophilus influenza, glucose is decreased and the protein increase. Using of antigen detection test, as you see, directly in spinal fluid by using 1 drop of antigen with 1 drop from CSF, Maxwell, then read the result. If the aggregation or clumping is formed, this means positive result. No clumping is negative result. Help in the spread of and the faster detection of this bacteria and beginning of treatment. Culture specimen are ground on isovital X enriched chocolate agar and typical colonies appear. Haemophilus influenza is differentiated from related gram-negative bacilli by its requirement for X and V factor and by its lack of hemolysis on blood agar. This bacteria is non-hemolytic. Now, immunity infants under age 3 months may have serum antibodies transmitted from their mother. During this time, Haemophilus influenza infection is rare, but subsequently antibodies are lost and decreased. Children often acquire Haemophilus influenza infections, which are usually asymptomatic, but may be in the form of respiratory disease or meningitis. Now, immunization of children with Haemophilus influenza type B conjugate vaccine induce the same antibodies and lead to decrease of meningitis and Haemophilus influenza type B infection dramatically. For treatment of this bacteria, the mortality rate of untreated Haemophilus influenza meningitis may be up to 90%. Many strains of this bacteria are susceptible to ampicillin, but up to 25% produced beta-lactamases under control of transmissible plasmids. This means the strain of this bacteria, which do not have the plasmid, is susceptible to ampicillin. This plasmid is rich to the bacteria from the environment when conjugated with the other strain of bacteria or other strain from closely related species. Essentially, all strains are susceptible to new cephalosporins such as cefotaxime, ceftriaxone, cefoyorod, and other. Cefotaxime intravenously may give excellent results. يعني حاليا استخدام المستخدم أكثر في العلاج هو infection or encapsulated Haemophilus influenza type B. It is transmitted from person to person by respiratory routes. So can be prevented by administration of conjugated vaccine to children, and children aged 2 months or older can be immunized with this vaccine. One of 2 carriers with appropriate booster doses according to standard recommendations. Children aged 15 months or older can receive Haemophilus influenza type B vaccine conjugated with area toxoid. Widespread use of this vaccine reduces the incidence of Haemophilus influenza type B meningitis in children by over 95%. This is excellent percent and the medicine. The vaccine reduces the carrier rates for this bacteria, and the prophylaxis with rifampicin is recommended for such children. And endemic cases can be used prophylaxis antibiotics such as rifampicin and can be using of ampicillin. Now, Haemophilus duty. This bacteria is responsible for the sexual transmitted disease called chancroid or soft chancre. Chancroid consists of a rigid ulcer on the genitalia with marked swelling and tenderness. The regional lymph nodes are enlarged and pitiful. The disease must be differentiated from herpes simplex and lymphogranuloma venereum. Syphilis caused by Treponema pallidum, herpes simplex virus 2 and 1 associated with genital infection. Lymphogranuloma venereum is caused by Chlamydia trachomatis. Soft chancre or chancroid should be differentiated from the chancre that caused by Treponema pallidum by syphilis. Chancroid of Haemophilus deuteri is soft, while in case of syphilis is rigid or hard. This bacteria small gram-negative rods occur in strands and the lesion, usually in association with other biogenic microorganisms. As a lesion in the skin, biogenic microorganism also presents. This bacteria require for X factor but not for V factor. It's ground-based from scraping of ulcer-based from skin on chocolate agar containing 1% isobutyl X and vancomycin. We use vancomycin as a selective agent in the culture media because of vancomycin able to inhibit the growth of gram-positive bacteria, especially Staphylococcus epidermidis, other staphylococci is the main normal flora presence on the skin. This antibiotic can be used in concentration 3 microgram per ml, and in incubation in 10% CO2 at 33 degrees. There is no permanent immunity following chancroid infection. Treatment can be done by using intramuscular triaxone, oral trimethoprim sulfamethoxazole, or oral erythromycin, often resulting in healing in 2 weeks. Thank you for your listening. شباب اكو سؤال؟